people are maybe self-diagnosing or over-pathologizing based on like a single post, or when they can't differentiate, is this actual clinical information coming from somebody who's trained, or is this somebody maybe talking about their lived experience? And which lived experience, I want to very much emphasize, is very, very important. And I think people should talk about their lived experience. But one person's lived experience doesn't equate to everybody else's lived experience.
Hello, my friend, and welcome to Something for Everybody. My name is Aaron Mashpitz. Jessica, welcome to the show.
Thank you so much for having me. I'm really excited to be here.
Absolutely. Yeah, my pleasure. First question, most important question is, how are you doing? Like, actually, for real, how are you doing?
I love this question because I think a lot of times you're like, I'm fine. Right now, today was a little stressful. And long. So I would say like exhausted, but I'm also excited to be here and talking with you. So that's making me a little more energized. But if you asked me like an hour ago, I would have probably said just exhausted.
Well, thanks for answering honestly and for making space to have this conversation. So I do appreciate you.
Of course.
So one of the things that I was most interested about talking to you about is this idea of giving out mental health information via social media, but sort of where the line gets drawn, where like people adopt the therapy speak and almost like diagnose themselves potentially based on some of the information that they're receiving. Like, obviously it's important for professionals and experts to share as much as they can on social so people can use that information to be proactive about their mental health, to think about how they're feeling, to organize their emotions in a way that's really beneficial for their life. But do you think there's a point where it becomes, it's not like the creator can control that, obviously, but like the people receiving the information, how they deal with it, how they take it on, and maybe how they diagnose themselves or pathologize themselves, or what's your view on that, as someone who posts a lot of content, has 2 podcasts, like is in the trenches with this stuff?
Yeah, I mean, I have a lot of thoughts, so I'll just start rambling and you can
Please.
jump in. Yeah, I think social media is such a good way to get mental health information out there to people that, may not have access to the information. But when it comes to like self-diagnosing or kind of, reading maybe one post and they're like, oh, that sounds like me, this must mean I have this, that's when it becomes problematic, because social media is not nuanced. And that's something I talk about a lot on my platform, right? Like, you cannot possibly talk about the nuances of a mental health diagnosis in a single Instagram post, for example. So I think, exactly like you said, the creator cannot really, once the information is out there, the creator can't really control who is doing what with that information. So I think some responsibility on the creator to make sure it is as nuanced as possible, also generalized, saying like, hey, this is general information. With regard to self-diagnosing, what I have seen, because I work primarily with teens, is a lot of teens will come into my office saying, hey, I saw, this TikTok or this Instagram post and I really related to it. And that can open a conversation for actual like further assessment, diagnosis, and things like that. So I think that can be a positive. Where I see it not being as positive is when people are maybe self-diagnosing or over-pathologizing based on like a single post, or when they can't differentiate, is this actual clinical information coming from somebody who's trained, or is this somebody maybe talking about their lived experience? And which lived experience, I want to very much emphasize, is very, very important. And I think people should talk about their lived experience. But one person's lived experience doesn't equate to everybody else's lived experience. So I've seen a lot with like ADHD. Somebody might say, oh, I do X because of my ADHD. I don't know. I don't wear matched socks. I'm just coming up with something ridiculous right now. And somebody sees that and they're like, oh my gosh, I don't wear matched socks either. do I have ADHD? And that's where I think it can become problematic because there's so much information out there. It can be somewhat overwhelming to decipher what is actual symptomology, what might be me over pathologizing my experience, what is me just seeking answers for something I don't have, and maybe landing on something that I think fits but is not the right answer. So I don't know if that really answered your questions. Those were my initial thoughts.
Yeah, I mean, it's like, I mean, what in the perfect world, right? It would be like a young person who, like, I work with teens, like baseball and stuff like that. Like, they're much smarter, more capable than we give them credit for. But also, they're like, they've got so much stuff happening, more stuff than I had to deal with. And so we'll just, have that as like the top layer, like keep that in mind as this conversation goes on. But I think in the perfect scenario, they would like see a post from someone like you or someone who does that type of content. Then they would have like this interest that piques them, like, oh, that may be something that I need to look at. And then they could then see a 2-hour podcast that's about that exact thing, which could give them actual accurate information to then do something with it. And so if we have that, I mean, obviously that's available, we have that path, but we can't expect every person to be able to do that or have the time to do that. In the perfect world, I'd be like, that would be awesome. Like this post about ADHD from Dr. Jess was like, oh, this is cool. I know she did a podcast about this. Let me go check that out. Boom, 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 boom. And then they can have just a little bit more information about it. So I think that's important. But I also think this really strong sense of belonging has a lot to do with it. And let me know if I'm off base here, but like, I think a lot of times obviously they want to feel like they belong. Like that's just like we all do. Like I do right now. Like I need that. And so like maybe their buddy like just or their friend was like, hey, I've got ADHD. My mom took me here. We got it all sorted out. Boom, 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 boom. And they're like, oh, like, well, I want to fit in with him. I want to be part of that. Like, and then maybe they don't do the same necessary steps that person take, like talking to their parents or getting the appropriate help. And they just say, this is me now. And then they put themselves in that box. And then it starts to kind of, forge their identity maybe in the wrong direction. That's sort of just what I popped into my head. But
yeah, no, I appreciate all those thoughts. So going off the first one, I completely agree with you. And I think a lot of people, when they do self-diagnose off of social media, it's not usually off of one post. It's usually, oh, I saw this and let me dive deeper into that, exactly like you said, because the reality is mental health care is not accessible to everybody in the United States and other countries, but I can obviously primarily speak to the United States. So, for some people, okay, they have to do their own research. And to some extent, all of us self-diagnose. Even if we go to therapy, we usually are going to therapy because we're like, I think I might have this thing going on. But to your point, like if people are seeing one thing, oh, that relates, let me look into this concept more. You're gathering more information. You're getting into that nuance that I was talking about because it's not just a black or white Instagram post. But with regard to the second part, the sense of belonging, I see that a lot. And I feel like social media is great in the sense that you can connect with people that otherwise you would have never been able to connect with. So especially, we've been talking about teenagers a lot. If they live in an area that maybe they feel different, isolated, don't have a lot of people around, social media allows them that connectivity. And to your point, it could also be, oh, I feel like I need to fit in or belong. And not that whether it's intentional or unintentional, pathologizing of their lived experience. And I think all of us do that to some extent, whether it be with mental health or something else. Like if we want to fit in, we may, do things that may not, I don't know, be innate to our being. I'm sure you have I have memories of doing that, like especially in high school, doing things to fit in with a peer group to feel like I belong.
Yeah. I mean, my whole life was shaped by that until I decided not to do that. Like I didn't really have many friends in high school. I had very few, but I played baseball. So that was like my thing. So I got my outlet there. And then when I got to college, I was like, oh, I'm just going to be a brand new person. and then alcohol got introduced, and so I became that brand new person because of this outside source. And then like people liked me, and I was good at a sport, and I was the loud guy at the party, and I threw parties at my house, and then it was all just attention seeking behavior because I felt like I didn't get that with friends. Like my parents are the greatest parents I think anyone's ever had, so like love and support was always at home, but like in an outside space, like maybe I'm wrong, maybe I'm delusional about my high school experience, right? But like that's what I felt. And so then I did that in college, and then I took that even further, and I made my profession to become a professional wrestler because I wanted cheers and boos from a crowd of people that didn't know me. I wanted them to judge me, either in a good or a bad way. And then, I've tried to learn some of those behaviors away and try to just, do some other stuff. But like my whole life went on just trying to belong to something, to a group, to people, to, now I have it with a lot of different things. But I mean, that's the path I took. And I'm like, so for a young person, we can't expect them to like have it figured out. Like nobody has it figured out for one. We're just, flying by the seat of our pants, which I think makes life pretty cool. But I think we have to give that grace and that, and then like let them, steer off this way and then bring them back this way, and have those sorts of ups and downs as they try to spiral up in their life. So I think that's important.
Oh, absolutely. And I mean, like you said, wanting to belong is part of human nature. And then the opposite of belongingness is isolation, or I guess it's one of the opposites. And we know like isolation is not good for anyone, like especially mental health wise. We see when we feel isolated and alone, we see more depression, anxiety, substance abuse issues, and things like that. So if people don't want to feel lonely and isolated, exactly like you said, we can't blame them for trying to do things to belong, whether it is over pathologizing symptoms or something else. Like to your example that you just gave, you went to college, alcohol got involved, you became the life of the party, loud guy at the party, and then that was kind of your identity. And I think we all go through that in life, depending on the feedback we're getting from other people. If you're getting positively reinforced, even if the behavior doesn't align with you, or I don't know, doesn't always feel good or needs outside influences, you're going to engage in that behavior more because you're getting that attention.
Yeah. Yeah. And then you start to shape shift a little bit, and then you enter into rooms trying to, fold who you are a little bit, and all that stuff is part of becoming. And then eventually you realize like, you're the best you. Might as well just try and be the most authentic version of myself. And those people who accept me will know the exact real me, and we'll be in the trenches together, and they can understand me, and I can go to them for help, and they'll celebrate my wins and all of those beautiful things that come out of, amazing relationships, which is really the key to the good life. So yeah, it's good stuff.
Absolutely.
Yeah. Is there any, this is kind of an interesting question, maybe. Is there any assumptions that you hold that have made your life better?
Ooh, that's a really good question. That like kind of hit me deep. I think I'm the type of person, and especially working as a psychologist for years, I think this assumption has gotten stronger, that at least in the short term with regard to making my life better, I tend to assume people like want the best and are trying their hardest. And a lot of that has been shaped by my work doing therapy for so long and becoming a psychologist. But I try to assume that people are doing the best they can or have the best intentions. I recognize that is not always the case, but I think going in with that assumption or mindset makes my life better, because then I'm not looking over my shoulder wondering what people's like true intentions are. And I always say in therapy too, like with my clients, I'm going to assume you're telling me the truth until I have evidence that you aren't. And I want to assume the best in people, which I guess could get me hurt, but also I think it's helped me so far in life.
Yeah. I mean, I couldn't agree more with that. I try to hold that assumption too. It's like, why not? What's the other option? The other option is assuming that people are doing bad things on purpose. I even think that people who are doing bad things don't think they're the villain in their own story. You
Oh,
know, like
absolutely.
even like all the worst dictators throughout history assume they think they're doing the right thing. Like they're obviously got some issues off. Doesn't really have to be said, but like they're still assuming that they're trying to do something. They're trying to rid something of someone, right? And we don't have to assume those people are doing the best they can, but there's an assumption of just like the general person who's walking around on planet Earth, like they are probably trying the best they can with the situation that they have, with the environment that they were given, the circumstances, the parents, the whatever, like, and then you have a lens that's like, it's much more compassionate rather than like judgmental. And, you know, that I think it's at least a better way to live than the other way.
Yeah. And I can even think of, you know, situations in my personal life, like outside of therapy, where say I have a gut reaction that's negative because somebody did something or said something to me. I think having that assumption and lens allows me to kind of pause and say, okay, what do I actually think their intention was versus, you know, how it came across to me. Because I think that also allows me, like, okay, if this was actually with good intentions or they were doing the best they can, what, you know, may have been lost in communication or things like that. And that's just helped me as a person and human to reframe in times that I get upset or hurt by other people's actions.
Yeah. What have you learned about yourself from being a therapist?
Oh my gosh. Uh Boundary setting, that I needed more boundaries. That's probably one of the biggest things, because I still am to some extent, but I've always been like a yes person, a people pleaser. And that really came out um, in grad school, definitely, but especially when I was like in independent practice, you know, recognizing that if I say yes to everybody, I will just burn out and I can't show up the way I want to. Um, I've also honestly learned a lot about all the privilege I hold working with people of different backgrounds, ethnicities, socioeconomic status. And that has really driven me to, I don't know, shift my worldview and try to learn and educate myself even more so than beyond like what's required. Because if I'm being totally transparent, like, you know, your annual CEUs is not a ton to learn about, you know, multicultural backgrounds and things like that. So I think that's something. And I've learned that I'm probably more capable than I used to give myself credit for. I've always been one that's been really hard on myself. And being in the therapy room with a client and, you know, going back to getting feedback that, you know, I'm helping someone, or even in times I don't think I am, and get positive feedback. That's really helped me recognize like I do have strengths that I probably don't acknowledge in myself a lot.
Yeah. I have a couple points there, but I'll go back to the initial one about boundaries. How did you set those, like, yourself, or how are you teaching your clients to think about those emotional parameters?
So with regard to me, because I think it's slightly different since I work with like teens and children, like the boundaries I set may look different. So I really started with work. So things like not checking email after hours or on the weekends. Like it sounds small, but that makes a world of difference, because I have a traditional Monday through Friday 8 to 5-ish. I'm putting that in quotes because it depends on the day. But like when I get home, I'm not checking my email, responding, you know, setting certain policies with regard to like no shows, cancellation, which feels uncomfortable at first, but you have to do it. And also part of it is modeling boundaries. I'm still working on this one, but like taking my PTO and recognizing like that's okay. So a lot of my boundaries are around work. But with regard to like teaching boundaries, I mean, there's so many different tactics, and it really depends on what area clients want to work. Since I work with primarily teens and children, a lot of times with my teens, it is boundary setting with like friends or family. And that can be really hard, especially if you're trying to set boundaries with like parents or guardians. Like, I mean, adults have difficulty doing that. But initial steps are like reflecting on what areas of your life do you think if you had more strict boundaries would be better? How is not having boundaries impacting your functioning, your mental health, your well-being right now? And we start with small things. So it might be something as simple as, say, a teen's like, I'm really struggling with this one person. I really don't want to be friends with them, but they keep inviting me out. Starting with something small like, hey, unfortunately, I can't hang out with you tonight. That's a boundary right there. Sometimes I'll even like sit with a client because working with teens, have their phones texting all the time. Hey, let's draft something together. I remind them that no is a boundary. That's a full sentence. It's a boundary. A lot of teens also want to do boundaries with themselves, which I love to see. Social media is a big one, like working on boundaries with not scrolling until 2 a.m. So how do we set a plan in place? So it really just depends on what they want to do. But I always emphasize that boundaries don't just have to be with other people. It can be in school. It can be within yourself. It can be, I don't know, with habits that you have.
Yeah. I came across a really good acronym for social media.
Okay.
It's time, and the T is for time bound. The I is for intentional. The M is for mindful, and the E is for enriching. So like when I'm thinking about social media, I'm like, is it past the time test? Like, okay, let's scroll 20 minutes. Am I intentional? Yes, I'm looking for a specific bit of information on this, or I'm looking for a new podcast guest in this sort of category so I can have different conversations. I'm definitely being mindful about it because my intentions are there, and it's enriching because I'm getting freaking fired up about finding a cool person to talk to. So that's I mean, when I came across that, I was like, oh, that's really cool. So I think about that now when I'm on social. Not that I'm perfect, obviously not. I still do it, sort of mindlessly, doom scrolling. But when I think about it beforehand, and I'm like, okay, I need to do this because I do need to find guests like you do, and for your show and all that. Cool people live on social media doing really cool shit that like very few people know about, and I want to find them and talk to them and see what they're doing. So, but that acronym was cool for me. So maybe it'll work for someone who's listening. Yeah.
Yeah, I'm going to take that. Thank you.
Absolutely. Sure. Didn't come up with it. I don't know who did, but kudos to them. Sorry for not giving you credit. But on the boundary piece, man, yeah, like that was like so hard for me to learn. I guess a little backstory. In 2018, I lost my big sister Rachel to suicide. And then maybe a year-ish, well, no, like immediately afterwards, I started posting on social media about, mental health and all of these things that were just in my brain that I wanted to talk about. And soon after, I was getting just floods and floods and floods of messages from people who like didn't have anyone else to talk to that were talking to me. And I felt like a crisis hotline, and I felt like I had to be on my phone all the time, every single day, because if I'm not, then I could get the same phone call that I got previous about my sister, that this is the last message they sent, this is the last text they made. And then I started a nonprofit. And so it just sort of skyballed from there because my mission was to save the whole world, because that's, sort of where my brain went immediately after this catastrophic loss. And so now over time, it's been almost about 6 years. September will be 6 years. I've been able to, kind of wrangle that in and control it and niche down into who I actually want to help. Now my nonprofit is specifically for professional wrestlers because there's very little mental health resources in that community. But it took me upwards of 4 or 5 years to figure out how and not feel guilty about it, to how to not be like scared out of my fucking mind that I was going to be the last call for that person. I don't know if I'm sure you've experienced something like that, but like that's a horrible feeling. You can't sleep. Like your brain is active all the time. You don't know what's happening, and I don't even know these people, but I feel something for them because it's heartbreaking to know that me, a stranger who just posted something on social that says, you're loved, or I'm here for you, or whatever the case may be, that they're more keen to go to me than potentially someone else in their life that they actually might know. And so having to sort of maneuver through all of that with no sort of training or background, just like jumping into the deep end, giving myself time to put those boundaries and emotional parameters and sort of figure it out, where now I like have a good grasp on it. And so I have some help and some protocols in place and things like that. But man, really tough. So if, I don't know, just stream of consciousness there.
Yeah. No, I appreciate that. And first, I know sorry doesn't change anything, but I'm really sorry for your loss. My cousin died by suicide, which is actually why I switched my path into psychology. So although not a sibling, obviously suicide loss is extremely different from other types of loss. And so going off of that and everything you were saying, I felt the same way. Like even before I really started making content on social media, I mean, I'm a millennial. We grew up with, MySpace and like the social media generation. And, I would, had blogs and all that kind of stuff. And when I was in grad school or would post about mental health, people would reach out. And then when I actually started making content and people see I'm a psychologist, like, I would get all those messages too. And just like you, I'm like, I feel guilty not responding. I have the quote unquote benefit of using my license as like a buffer and saying like ethically I can't provide therapy services. But it is hard because you see these messages and you're like, I don't know if they've reached out to anyone else. I don't even know this person. I don't know where they are. And exactly like you said, then you're on your phone, you're staying up at night. And it eats at you, for lack of a better term. And like you said, I know you said your mission was like to save the world. You're one person and you can't carry everybody's pain and suffering, because that's not fair to you. And you didn't explicitly say this, but I would imagine it took a toll on your mental health trying to wrestle with all of that. I didn't mean to use wrestle as a pun. It came out of my mouth and then I was like,
nice. Yeah. Nice.
Yeah.
No, it did. And a lot of this was happening like right when COVID started. And I also lost my job at the time because you can't wrestle in front of 0 people. So I had like a lot of time to just like drink and do some other stuff. And then everything just like seems like it's so big and I don't know how to tackle it. And then I took this job at Walmart, which was like a real blessing because I couldn't be on my phone for 12 hours of the day while I was working. And it gave me time to actually like think like, okay, this is still very, very important to me to talk about mental health and do all of these things. But where can I make this direction more clear for my own sanity? Because if I don't do this anymore, then what was the point of it all? And so other great people are doing it as well. We need a, collective action, obviously, but I make a dent. I believe that. And so that gave me a lot of time and space to like think about, okay, what's the direction you want to go in? Okay, if wrestling's not a thing, maybe we can do this and this and this, but we can still be involved here. So like space and time and perspective and not being on my phone and Walmart gave me time to actually, move in the direction I wanted to go. And now you fast forward to right now and here's what we're doing, having a conversation about it. So.
Yeah. Well, and you just brought up COVID, and I think COVID was such a pivotal, I mean, COVID still exists, but like we're not in the midst of lockdown and stuff. Pivotal moment for so many of us. Going back to things we've already talked about, that isolation. You mentioned job loss, and we saw that. I also saw an increase of people not only posting about mental health on social media, but exactly what you were saying, people in crisis because they're alone or they lost their job, or maybe they didn't lose their job, but now their kids are being, virtual school, so they can't work anymore, or they lost a family member due to illness, or like all of these things. And I mean, there's research out there that shows that mental health got significantly worse since the pandemic, increases depression, anxiety, substance abuse, all that kind of stuff. But I'm glad that you were able to get the job at Walmart and it allowed you to kind of take a break and gain that perspective that it sounds like you needed. Because I think so many of us, just like you shared a little bit about yourself, just kind of were at home and sitting, thinking, maybe not doing the best things for our overall health and well-being, because we were stuck.
Yeah. Yeah, there's obviously a time and place to sit and reflect and think, but not not in that sort of degree, with that sort of forced, not forced, that's not the right word, but in a manner that was beneficial for whatever society, but we needed to happen in that moment, because it's like uncertain and things are everywhere. But anyways, to the other thing that you brought up when you were talking about what you learned about yourself was being hard on yourself. That's another interesting one, because you see this a lot with everyone who's great at what they do, especially athletes. And so, like, it's hard to say not to be hard on yourself, simply because it takes you to a level that you probably wouldn't have gotten to without it. And so, at least in sports world now, like when I was growing up, it was like grind, hustle, grind, which is important, still part of the work, right? You still have to put in the work. That's always going to be there, important. But part of now the conversation that's equally as important is rest and recovery. And so thinking about that in combination, in harmony, like still having this chip on your shoulder, potentially still saying, hey, I want to do this and I can be a little hard on myself, but I still have to give myself moments of rest and recovery and things of that nature. I can still be kind to myself in my moment, but I can still push myself a little bit, knowing where, the tip of my edge is. If I get to the tip, how can I come back a little bit to rest, to get to that tip every day? And so I never want to demonize that, because like for me specifically, when I was in college, I had a bad baseball game, 0 for 4, whatever the case may be. I was in the cage till the middle of the night working on my swing. Now, was that healthy? I don't know.
Yeah.
Could I have gone about it a different way and still got in the same work? Potentially, yes. But for me, it was like, dude, you got to get your shit together. And so I went to the cage. Now, could I have got a really good night of sleep, rested, reflected on the game, journaled about some stuff, and then got into the cage the next morning? I probably would have taken better, more productive swings instead of just drilling myself into the ground for 4 hours. So there's still a place always to do the work, but like having that space to like actually reflect on it and then rest and recover and then go about the work, I think now is being much more talked about, at least in the sports world, because that's the world I live in. But I think it's the same for someone who like you, who's elite at what you do. Like you're a doctor. Like you didn't just get that by like sleeping through all your classes. Like, you put in the work, you did all of these sorts of things and you want it to be better. And in college, sometimes you don't have enough time to sleep because you got a lot of stuff going on. You work into the middle of the night and things like that. But there's times of your life where you do have to sprint. There is like a lot of entrepreneurial stuff. Like you got in your podcast, like you don't have anyone helping you. You got to edit, you got to record, you got to do this, you got to do that. And then all of a sudden, there starts to be people helping you on that train, and you can pull back and you can delegate and you can do all sorts of things. I just mix like 75 different professions into one thing.
I followed you though.
But so yeah. I think you feel my point. What do you think on that?
Yeah. No, I love that you talked about that balance of like the grind, but also rest and recovery, because I work with a lot of teens that are super high achieving. And I see this so much. Like the people that, exactly like you said, excel at what they do, are really bright, really talented, are the ones that tend to be the hardest on themselves. Like, well, I just need to do more. I need to do better. And there's this like false belief out there. And I say false belief because it's literally been debunked by research that if we're just like hard and mean to ourselves all the time, it's going to motivate us. So I can't remember exactly what you said. I think you said like you need to get your shit together. And so then you were in the cage.
Yeah.
And like, yeah. And maybe that like motivated you in that moment. But to your point, if you got a good night's sleep, reflected on it, and then went out the next day, we don't know because you didn't do that, but it's most likely that you would have made the progress you did in a shorter amount of time because you would have been rested. You wouldn't have been as angry, as hard on yourself. That voice inside your head wouldn't have been like, Aaron, come on, Aaron, you have to do better, like be better. But there is a balance, because you also can't just be like, I'm just going to rest all the time.
Mhm.
Right. So it's finding, that level of what's going to push me to the next step, but also like allow me freedom. And an example I can use working with like teens a lot is my high achieving teens that like will study for hours and hours on end to make sure they get the best grades. And I'm like, okay, if you studied for 1 hour instead of 4, what kind of grade would you make? And they're like, oh, I'd probably still make an A, but like, I just need to like make sure I know everything. And I'm like, well, what could you be doing with those 3 extra hours? You could be resting, journaling, doing activities you enjoy, and you're actually probably going to perform better because you're spending time doing other things that are beneficial. So yeah, I completely agree with what you are saying. And I think exactly like you said, the people that really excel, the people that work really hard, tend to be harder on themselves than the people that are like, I'm fine just kind of being like, I don't want to say average in a bad way, but like, I'm fine kind of like going through life. I like this. I like this. I don't plan to be the best at this. And they're not going to be hard on themselves because they're doing it because they enjoy it. I don't know.
Yeah. Yeah. No, I mean, I told you before we started recording that I'm coaching a 9U team, and one of the things that I'm trying to get across, at least to young parents of athletes, is that there is a dark side to trying to become the best at something. And we, like Dr. Michael Gervais, someone I really follow, he's a sports psychologist, talks about this a ton. Like, he works with the best in the world, but he's like, there is a dark side to all of it. The people that I work with at the tippy top are anxious. They're nervous. Yep. They're running away from something, not towards something, right? They're doing all of these things, but they want to be the best of the world, and they're willing to sacrifice all these other things to get there. And when I'm talking to these young parents, I'm like, is that what you want for your child? Is that what they want? And they can't make that decision at 9. It should all be fun. We're playing tag before the game, like all that stuff, right? But when you get to a certain level, then you have to start asking these very, very, very serious questions. Are you willing to give up basically everything else? Relationships, fun, trips, vacations, junk food, to be the best in the world? And if you are, great, let's go for it. I want to help you get there. But if not, that's also great. There's so many other cool things that you can do. You can travel the world. You can go hang out with friends. You can learn other hobbies. You can do all these other fun activities. You can learn how to weld. You can be a dancer. You can do all these things all together at one time. You can learn about turtles. You can watch a YouTube show. Like all these cool things that potentially could be something that lights you up and makes you joyous and gives you fulfillment. But you have to think about the dark side of these really high achievers, because you look at LeBron James or people who are the best in the world at something, you're like, oh, I could do that. Could you? Could you be on the cover of Sports Illustrated at 18 and be given $20 million? And you just, because like from an outsider's view, he's fucking crushed it. Like, I don't, he's a great family, loves his kids, like does really hard work, like helps out in all this stuff. I don't know anything about him, but this is what I see. Right. But like, but like, could you do that same thing? Like, and thinking about that as like, you want to be in his shoes? Well, you got to walk the same walk that he's walked for a really long time, sacrificing all these different things. And so I try to talk to young parents about that. It's a hard conversation because everyone wants their kid to be the best they can at something, but that's a lot. There's a lot that goes into thinking about those kinds of things.
Yeah. I love that you brought that up about like the sacrifice piece, because whether it's sports, whether it's, being the best student, whether it's, getting that promotion or working your ranks up in whatever job you're doing, you are going to have to sacrifice other things. And usually the things that you have to sacrifice are things that are really important to you and that you value. So relationships, time with family, things like that. And I think a lot of times, there are times, like I think of when I was in grad school. Yes, graduate school had to be my primary focus. I had my partner. He was very supportive throughout the whole, 6 years I was in grad school and everything. We moved and all of those things. But like my focus had to be to get to where I am. And then now I can adjust that. But to your point, like if you're trying to be the best and that's the only goal, reflecting on what else are you going to sacrifice? The other thing I hear a lot, and I don't work with athletes other than like high school athletes, but talking with, sports psychologists, I know, especially in the sports world, but it can apply for other things. Like if your whole world and identity is this one thing, and then you get injured or something happens. I mean, I'm even thinking jobs and going back to the pandemic. You could have worked so hard in whatever job it is. A global pandemic happens. If that's your identity and you lost your job, who are you outside of those things? And if you had to sacrifice all of those things on the way, you lose that. And I think making this a broader discussion, it speaks to like kind of knowing what your values are and making sure that even if, this one thing is the primary goal you're working towards, you still are carving out at least a little bit of time for other things in your life that will add joy, add value, and I guess add to your identity, because unfortunately we have learned over the past 4 years that life can change in pretty much an instant. And then it's a lot of rediscovering yourself.
Yeah. Yeah. Back to Dr. Michael Gervais' advice. He calls it a performance-based identity versus a purpose-driven identity. And he likes to think about that when talking about athletes. Like, your performance is going to be this or that, but you're going to leave the field and you can have a purpose-based identity. And how do you thin slice that purpose? Exactly what you just said. Like, what are your values? Like, what do you live by? Like, when you're dead and someone's talking at your eulogy, what are they saying? They're not like, they might say Aaron was a cool wrestler and he played baseball, but really they're saying like, hopefully, he was kind and thoughtful and caring and compassionate. He was honest. He was a little loud at times, but that's okay. Things of that nature that are more about the intrinsic character of who you are rather than the things that you did or, stuff like that. And I think that's wildly important. And it goes back to our original conversation about figuring out who you are. If these are the values that you say that are important to you, then you're going to try and walk into the room and be about those values rather than be a pretend version of something else that you might think is cool that other people want you to be. And it's like this whole jambalaya is going on in your brain. And like, but no, I want to walk into this room and I want to try and be honest and I want to try and be caring and I want to be curious. That's my goal. I'm thin slicing my purpose. That's for what I'm trying to do in this next 30-minute social endeavor that I walk to this coffee shop and I'm meeting new people. Great. Let's go try and be about it. And then you come back and you reflect. Was I about those values? Okay, here, I was really good. Maybe I missed the mark here. That's okay. I tried my best. Boom, boom, boom. And then you think about it in that way. And I think that helps you, at least it's helped me think about my identity outside of, as wrapped up as a baseball player or a professional wrestler. Now just, maybe my identity as a podcaster, which maybe is pretty cool. It's not, whatever, but
yeah. No, I love doing values work, especially with my teens, because I feel like I never thought about my values when I was a teenager. I was just going through life. But going back to when you were talking about like LeBron James, like, oh, from the outside, it looks like, everything's perfect. And I'm sure you hear that a lot. I hear that a lot. It's like, I have no reason to be upset, or I have no reason to feel like this because I have X, Y, and Z. These are all the goals I work towards. And a lot of times it comes down to like, yeah, you've achieved these things, kind of going to like what you said about like purpose driven versus performance driven. You have these achievements, but do they actually align with who you are? Or were you driven by that because that's what you thought you wanted to do? I hear this a lot with, teens, like, oh, I'm going to be a doctor because my family is full of medical professionals. But do you actually like that? Like, because if you don't, you're going to be miserable doing that. Is it because that's what you have been told you need to do, or it actually really aligns with who you are? And the cool thing about values is they can change over time and life experiences. And I always encourage people when they're kind of like, just something doesn't feel right, whether it's as, a simple new social interaction or something much bigger. Okay, well, let's go back to, what you value in life. Does this align with who you are, the person you want to be? And a lot of times we find that there's a mismatch. Like you mentioned, honesty. That's a perfect example. If you are someone that values honesty and you find yourself in situations where you feel like you can't be honest or feel like you have to, lie or bend the truth, you're not going to feel good. And that's probably a sign to you like, this situation is not the best for me.
Yeah. Yeah. But I mean, based off that, you have actual reason and evidence that that this might be not the situation for you, rather than still trying to fit in or mold yourself. And sometimes we do have to do that. I don't say that's like never appropriate? Obviously it is.
Oh,
Like we're in a
absolutely.
society with other people, and like, sometimes we do have to just, do that. But if we can have that choice of like who our friends are and the communities we want to hang out with, we do have that choice, and we want to have those in alignment with who we are. And that's really powerful. But that takes, that's a never endlessly evolving process. So.
Oh, absolutely. Absolutely.
Yeah.
And one thing I wanted to add to something you just said, like there's times we have to mold and stuff, and absolutely. And one thing I try to work on with my clients and do in my own life when it comes to values is like, there's situations where I always say like the person I am at home versus work versus like out at a restaurant with my friends, like, yes, I'm the same person, but I'm going to act a little different. So we can still live in alignment with our values, and it just might look different given different situations. So like if you value honesty, maybe at work, the way you are honest is not the same way you're going to be honest with your partner or your friends. Maybe you can be more blunt with them, but at work you have to, modify your tone to get your point across. So yeah, we can mold, but we can still be true to ourselves within that molding.
Yeah. Yeah. All right, let's take a hard left here.
Okay. Great.
Don't have a great transition for this, but something I really wanted to talk to you. Well, there's a ton of things, but maybe we'll just get to this last thing. But when my sister passed away, a lot of stuff that I saw and read about was that suicide was selfish. And I've thought a lot about this, and I've done a few episodes about this, and it's something that I'm really passionate about. But I just want to hear your initial thoughts on the statement that is suicide selfish, or it is selfish, or just the general idea of talking about that.
So my raw thoughts, gut reaction is I hate that statement. I will follow that up with, I can understand why people who have lost someone to suicide may perceive it that way and may feel that way. And I want to validate those individuals' feelings, because from the outside, it's like, how could this person leave me, leave the family behind, leave all of this? The reason I hate that statement is because when people die by suicide, they truly, truly believe that the people in their life would be better off without them. They're so depressed, low, whatever word you want to use, that their belief is that them living is burdensome to the people around them. People don't just die by suicide. Okay, let me clarify. For the vast majority, because you might have people that are dying by suicide for like political statements or other purposes. But if we're thinking in the realm of mental health, it's not something that just one day they wake up and like, yeah, I'm going to do this. I don't know the statistic off the top of my head, but it's something like 97% of people that die by suicide have a diagnosable mental health condition. So these are people that are struggling, suffering, and truly believe there's no other option for them. And I'll be honest, like high school me, before I did a bunch of research throughout graduate school on suicide. That's like what my research focus was before I ever had lived experience with suicide. I probably said that too, because I didn't understand. Yeah, so that was a very long-winded answer. So I hate it. I can see why people on the outside feel that way. And if you knew the pain the person's in, it's hard to really call them selfish.
Yeah. Yeah, that last part I think is the most important. Like I never thought about it once with my sister, because her battle was like a little over 10 years, and wow. She was, severely depressed. She had bipolar disorder. At the end of her life, she developed schizophrenia. So just like a lot going on, and the amount that she fought and battled and stuff that she still accomplished, all of that, like incredible. And so for me, it was never something that I thought about her, but it's something that I received from other people. Like, how could she?
Yeah.
That's so selfish. And then I really think about it. And to your last point, it's like, well, thank God that you've never experienced that sort of fucking horrible darkness in your life. Like, I thank God that you haven't, because I never would wish that upon any human being on earth. But for you to say something like that to me, or to, in general, about people who have ended their own life, you don't know the darkness that was consuming them, that all they wanted in their life was to not feel like this anymore, or to not be a burden to the people in their life. And so if you just, it's logical, like you said, it makes sense. Okay, this person ended their life. Like, the wake of suicide is forever. Like, I'll forever have this thing. My parents will forever have this thing. And the wake of suicide, again, lasts forever. But it wasn't like that. Just so logically, I understand where you can get there. But if you just have to think a little bit deeper about it and say, like, that person was an insurmountable amount of pain, and this was what they thought was the only way out. And so thank you for validating what I thought was true, and appreciate you indulging me in that question.
No, of course. I mean, to your point, like, if you think a little deeper, like, what would drive someone to end their life? Like, it's not like, and if you just reflect on that, and if you're like, I have no idea, I mean, I'm glad you have no idea. The other thing I think about a lot, and we'll use this comparison, if somebody had a physical terminal illness and had tried treatment after treatment, wasn't working, still suffering, we don't often, I'll put that because I don't like making absolute statements, judge people for saying, hey, I don't want treatment anymore. I'm just going to die. And I use that analogy because we still, even though mental health is being more talked about, it's still much more stigmatized than physical health conditions. And people, don't put the same judgment or stigma and say, like, oh, that's so selfish that this individual decided no longer to pursue treatment for their cancer. They say, oh my gosh, they fought so hard. They tried all these things and it was their time. We don't talk about mental health like that. Like, just hearing what you shared about your sister, you saw her fighting. You said 11 years. She still accomplished a bunch of things in that time, but you saw the pain and suffering that she was going through. And I think, people, yes, there is mental health treatment out there. Obviously, I'm a psychologist. There's medications, there's therapy. And sometimes, unfortunately, for people, like, they're doing all those things and it still isn't enough. And I'm not saying suicide is the answer by any means. And when you see people suffering for so long, I mean, I can think of clients I've worked with over the years that, like, in and out of hospital for attempt after attempt after attempt. And you're just looking at them and you're like, I can tell you don't want to be here. Like, it's our job to keep you alive and safe. But when you see that kind of pain, you gain a new perspective on, like, understanding why they felt like it was the only way to end their pain if they had been trying and trying and trying for years and years and years.
Yeah. I mean, all those modalities extended my sister's life, I think, for as long as possible. Like, having a psychologist and a psychiatrist, and over time trying to find the right medication, which is tricky at the beginning because you don't know what doses and all that. So you keep working through it. And sometimes she looked like a zombie at the start because she had no emotions, but she was a very emotional and fun loving person. And we wanted to see that part of her, and she wanted to feel that part of herself, even if it was like a little bit harder. So there's just like this period of stuff where you have to go, and like that, all of that stuff extended her life a long time. So I have a lot of love and respect for people who try those things like full throttle, and the people who are doing the treatments, like trying to basically save people's lives or enhance their lives or whatever the case may be. And so, but like that stuff is not for everyone. I don't think like my view on medication is like a little tricky because, it extended my sister's life and it was really good for her. But I think for a lot of people, it shouldn't be the very first option. There should be some other stuff that happens, like thinking about, their environment or their circumstance. Because I think a lot of people, when they think about mental health, they strictly think psychological. And like, I do believe there's a difference between being depressed and your life just being really shitty. Like there is a
I agree.
difference. And
Absolutely.
so people like misplace that. Like someone could be like diagnosably depressed, like their life seems good, they have a good family, all these things are nice, and they're just like really, really fucking sad. Like that happens. Or they don't have friends or family or a good job, and they have like their physical health is they're just like their life is not good, and that makes them sad. There's a difference between those two, and pros like you are obviously weighing those two out, like what should we do, what's the path to take, and things like that. But the regular person has to think about those things too as they look at their life in like a really honest way. And so that's why mental health is it's very tricky, right? It's this like invisible thing that we're trying to grasp, but you can't really see it, but you can feel it, and it's like, which direction do I go with it, and like who's the right person to help me? And like it's like a lot like dating, and you just gotta my fiance would always say, until we found each other, she was like, yeah, dating sucks till it doesn't. Like that's kind of like what it feels like to get the right treatment. Like it's gonna suck until it starts to feel better, and you start to understand, okay, these are my modalities, this is my mental health toolkit, these are the things that really fucking work for me, and I'm going to try and stick to these things. I have a great relationship with this therapist. She doesn't baby me, but she listens to me, and she helps me, and she challenges me, or he or whoever the person might be. And like, so you just have to sort of work through it. It's not like a one-stop shop thing, like, but anyways, I'm telling you things you already know, but anyways.
No, I appreciate it though, because I completely agree with what you said at the beginning. Like there's a difference between diagnosed clinically depressed and just having really, really bad circumstances, and that being a normal reaction. And I think I'm trained in clinical psychology. I would not change anything for the world. And I also think at least the field of clinical psychology is very focused on like diagnosing and things like that. And there's other areas of mental health, like social work, that do a lot better at assessing those factors. But one criticism I have of my field is that a lot of times we are quick to be like, oh, you're depressed because you meet these criteria. It's like, but let's look at the broader picture. Like if somebody doesn't have money to put food on the table, keep their lights on, I could do all the CBT, DBT in the world, and that's not going to fix their environment, which is causing a lot of their symptoms. Who wouldn't be depressed or anxious if every day they wake up and like, how am I even going to afford to get through the day? And I think, so I appreciate you bringing that up, because I think a lot of times, going back to our conversation about like over pathologizing from earlier, when talking about like fitting in or self-diagnosing, I think a lot of times we like to go into fixing mode of the symptoms of things without taking in the whole picture. If I have a client that comes in and their family can't afford to put food on the table, me trying to challenge their thoughts about something isn't really going to help. My job is to get them connected to resources so that they can even show up to therapy. If they don't have transportation, which I will say, one of the good things that came out of the pandemic was the use of telehealth, because it does make it therapy and other services more accessible to people that can afford them. But, if people are worried about, I can't even get to work because I don't have transportation, and then I'm going to lose my job and things like that, like anxiety is a normal reaction to that. And like, could medication help? Sure, it can reduce symptoms, but it's not going to get to the cause of the problem.
Yeah. It has its place. It does, because I've seen it save a life, or extend a life, excuse me. But there's tons of other things that we can look at first. If some of those other normal factors are figured out, like you have a roof over your head, you're not normal. I shouldn't say that. Just like basic needs being
Basic
met,
needs,
then okay, then how are we eating? What's that like? Do you have access to high quality foods or things like that? Are you sleeping? Do you have physical activity? Okay, some of these basic things. Okay, you are doing some of these things, but you still feel this way. Okay, let's find some different pathways for you. Let's do the best we can to ensure that you have the best mental health, and you can feel all these great things, and you can do all these great things that you're capable of, and all of this stuff. So there's obviously a place for it all. That's why it's in all of this stuff. But I think there's, I don't know, steps to it, or different, ways to organize around it. You sort of just spitballing here my own thoughts about how I think about these things. But yeah.
No, I appreciate that. I appreciate that you just talked about things like sleep and food and exercise. Because even as a psychologist that went to school for a bajillion years, it feels like, and learned all the like skills and stuff, I always call it with my clients going back to basics. Are you sleeping? Are you fueling your body? Are you getting movement in that is enjoyable to you? Are you bathing, brushing your teeth, like doing the hygiene? Because if you're not doing those things, not that you can't do like higher order therapy skills, you can't benefit, but like let's start there, because we know that having a nourished body, getting good sleep and getting movement in is going to benefit your mental health. Let's start there. Let's address those things. And then, exactly like you said, okay, we're doing all these things. We're still not feeling great. Here are some more applicable skills that you can use that will enhance those things. Like I said, it doesn't, like, if you're not moving your body, it doesn't mean you can't engage in like mindfulness or other, skill-based things. And there's benefits to things that all of us are probably doing, or at least at one point in our life did. So why not focus on starting there? It's going to be easier to start there because we all know how to eat, right? We know how to sleep. Sleep quality might be different for people.
Yeah.
Focus on those things and see how much better you feel already. And then we can work on higher order things.
Yeah. Yeah. In the sports world, we just say, be brilliant at the basics.
I love it. I love it.
And that's true. Also, if you are interested more in some more information about like the conversation we had about suicide, please check out Dr. Jess's podcast. I think you've done 5 episodes specifically on that.
Probably.
If I got that right, because I just listened to 1 or 2 of them. I think you've done 5, but they drill down really into like really specific stuff. So if you're interested in maybe helping a loved one, or just want to know more information and be more helpful out in the world, check out her podcast. She has 2 of them. They'll be linked in the show notes below. But any last minute thoughts? Where should people go to find you? Anything else like that?
Last thought. I mean, there's so many thoughts. One, I appreciate you having this conversation with me, inviting me on to your platform. I think one thing I just want to leave your listeners with is like the reminder that we all have mental health, like just like we all have physical health. If you're struggling, it's nothing to be ashamed of. And there are, going back to basics, like we were just ending on, ways to enhance your mental health if therapy isn't accessible to you. I'm not saying, going on a walk is going to cure a diagnosable mental health disorder, but going back to basics is going to help. So we all have mental health, and thank you for allowing me to come on and talk about it with you. As for where to find me, I'm on various social media platforms. Instagram and TikTok are probably going to be the easiest, and then I have links to everything else. So my handle is at Jessica Leigh, PhD. Leigh is Leigh. 2 podcasts, like you said. So Psych Talk is my solo podcast. And then I have Welcome to Group Therapy, which is a podcast I host with 3 of my mental health colleagues. So you can find me in all those places.
Yes. Thank you. And I appreciate the light, the love, and the information you put into the world.
Thank you.
If you enjoyed that episode, please click here for another full-length episode of the podcast. And please don't forget to subscribe. But above all else, most importantly, please take good care of yourselves and others. And I'll see you next time. Lots of love. Cheers.